Assalamualaikum. I am Siti Aisyah Nurain binti Zulkifli, together with my lovely partner Rosmana Bila binti Rosli, will present about seizure epilepsy. First of all, let me tell you what a seizure epilepsy is. A seizure is a burst of uncontrolled electrical activity between brain cells that are also called neuron or nerve cells that causes temporary abnormality in muscle tone of movement. Seizures are not all alike. A seizure can be a single event due to an acute cause, such as medication. When a person has recurrent seizures, this is known as epilepsy. Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizure or period of unusual behavior, sensation, and sometimes loss of awareness. Anyone can develop epilepsy. Epilepsy affects both male and female of all races, ethnic background, and age. Seizure symptoms can vary widely. Some people with epilepsy simply stay blankly for a few seconds during a seizure, while others repeatedly twitch their arm or leg. Having a single seizure doesn't mean you have epilepsy. At least 2 seizures without a non-trigger that happen at least 24 hours apart are generally required for an epilepsy diagnosis. Treatment with medication or sometimes surgery can control seizures for the majority of people with epilepsy. Some people require lifelong treatment to control the epilepsy, but for others, the epilepsy eventually goes away. Some children with epilepsy may outgrow the condition with age. There are 3 different individuals that we choose for our YouTube video documentary. Let's play the video in 3, 2, 1.
Before I was diagnosed with epilepsy, I was unaware of the triggers and causes.
Hi, my name's Chris. I'm in grade 4. I really enjoy football and karate.
My name is Katie Cook. I'm 20 years old. I live in Dublin, Ireland, and I love running.
Next, we go to the similarities between these 3 videos. Each sufferer faces these similarities during having epilepsy, which are brain control. They cannot control their behavior or their body movement during epilepsy. Most of their behavior will be like shaking on the ground and drooling. Other than that, each sufferer also has their own support system, which are mostly from their own family and teacher. For example, Joe has been helped with his coordinator at his university and also with help from his neurologist. For Chris, the main supporter are his own mother and his teacher. They always take care of Chris and make sure that Chris does not get too tired at school, because sometimes when Chris is too tired, he will get a seizure. In contrast to Katie, she had been helped with her doctor, Dr. Colin Doherty. He is the one who always accompanies Katie when she go out for running or when she enter the fun running event. Last but not least, all sufferers depend on medication to avoid the frequency of seizure. They need to take the medicine on time. Now, let's go to the differences between them. Each of them start to get epilepsy at a different age. Like Joe, his first time getting a seizure was when he was in the early adulthood stage, while for Chris and Katie, they get during their middle childhood stage. Next, the differences is the frequency of their seizure attack. Each person got a different time of attack. The most get epilepsy attack is Katie, as she will get like 40 times a day, while Joe only got like 7 times in 7 months. Last but not least, the third difference is the way they keep going on their life even though they have epilepsy. Katie and Chris are doing sport, and when they get an epilepsy attack during sport, they will stop for a while and then continue sporting. Katie loves running and she always come out running with her daughter, and she also joined the fun run, and sometimes she managed to become a winner. Chris is a football player and also practice karate. Now, he already has a black belt and aspires to go to the next level to get a brown belt. Chris also got the Best Clubman Award for his football sport. For Joe, he tried to minimize the seizure attack by adjusting his nightlife. The trigger of his seizure is because he is drinking too much alcohol and he does not get enough sleep. He tried to get to sleep early and drink less, and it is proven that he does not get an epilepsy attack for a while. Every everyone has their own challenge in their life, either easy or hard, and how they handle it. Seizure sufferers are also no exception in facing challenges. Based on the video, we can see the challenge that they had to face as an epilepsy sufferer. The common challenge they need to face is they need to take their medicine on time and never miss it, as it will result in a seizure attack. They also need a long time to figure out the right dose of medicine for their epilepsy. Everyone has different dose amount required. It is based on their body. However, even the medicine can lower the number of seizure attacks, it gives a side effect to them, such as for Chris. He has a worse memory and sometimes forget what he wants to do and need to wait about 20 minutes later to recall back. For Katie, in the early day of her taking the medicine, she got immobile and she needed to use a wheelchair for 2 years. In contrast to Joe, the medicine does not give him a worse side effect. Last but not least, one of the big challenges they need to face is the effect after seizure attack. Their body will leave a bruise, they are drooling, and their body will get tired. They need to rest for a while before continuing their activity.
Hi, it's me, Rosma Nabila binti Rosli. I will start my presentation in this video by discussing the support system of these three people and how this support system helps to overcome or lighten the challenges faced by them. Firstly, for Joseph, his first support system is his course coordinator at university. Joseph was able to go through his degree and pass quite successfully. Because of their understanding and support toward Joseph, Joseph was able to get the exam adjustment, assignment postponed if he needed it, and he was able to spend more time in the exam and take a longer break if he needed it. As we know, concentration is one of the triggers, and his course coordinators at university are aware of it, and they try to help Joseph in the most possible way, and clearly by all of their action, it really helps Joseph to overcome all the challenges that he had to go through in his degree journey at the university. His next support system is his friend. Of course, every people who have seizure had a hard time or took a while to telling people surround them about their condition or problems. But for Joseph, he felt very lucky because he have had friends who have been able to support him along the whole way and be understanding of his condition and what his restriction in his social life. Because of this, I believe Joseph does not feel uncomfortable, alienated, and assume himself as a burden to his friends, and he is able to enjoy his social life with all his friends like normal people. Next is Chris. One of his support system is his teacher. As soon as he started the medicine, it would make him get tired easily. So his teachers aware of it and make a time to pay more attention to his condition every single time, and they would send him down the back to sit down in the back of the classroom and sit on a bean bag every time Chris looks tired and pale, so that Chris can rest and relax a bit. This kind of support from his teachers really means a lot because it helps Chris to maintain his health and energy so that he can learn and play sports like his other friends at school. Also, his teachers will always make sure that the whole class is educated about epilepsy so that the kids also be a bit more understanding and supportive toward Chris at school. Next, his mother is also one of the person who keeps support Chris and not held him back from his passion, which is sports. His mother knows that Chris really loves and active in football and karate, and she keeps support Chris to enjoy what he loves to do, and this support from his mother made Chris believe in himself that he also can do whatever he wanted to do and make he realize that his epilepsy not the thing that can stop him to do something that he loves in his life. Then, for Katie, she has Dr. Colin Doherty as her support system. Dr. Colin has two roles in Katie's life, which is not only as her doctor, but also her partner in running. He is willing to be her pal in training or races, even though it is not his main job as a doctor. He willingly to be Katie's partner in running because he wants to make sure that when Katie has a seizure, if she is running, that nobody cuts her off the course because it will bring displeasure to Katie, and he will wait for Katie to recover and they will run together again. I strongly believe this kind of support from her doctor helps Katie to be more brave and confident and safe to pursue her dream and keep doing what she loved the most, which is running, even though it actually looks quite difficult when a seizure attacks her and she loses consciousness during her races or marathon. Her next support system is her own mother. Katie feels grateful and very appreciate that her mom understands and is just giving her a bit of independence where she can go out and do the things she wants to do. In my opinion, this action of her mom really helps Katie to enjoy her life and live the life that she dreamed of all this while and does not feel too upset or depressed about her illness. These all supports that were received by Joseph, Chris and Katie can be related to Bronfenbrenner's ecological theory that we learned in chapter 3. As we know, Bronfenbrenner's theory focuses on the social context in which people live and the people who influence their life or development. Based on this theory, it clearly shows a few environmental systems that are involved in these three people's life. Firstly, for Joseph, we have a microsystem in which he has direct interaction with his course coordinator at university that influence a lot of his learning development at university, and also he has direct interaction with his friends who are always involved and influence his social life every day. And then for Chris, we can see the mesosystem, which is his teacher and his mother work together to make sure that Chris is able to do well in his school and sport by always keep in touch, give information to each other and work together to understand Chris' health condition and his abilities and limits at school. Lastly, for Katie, we also can see the microsystem, which is the direct interaction between Katie with her doctor and mother that each party help her to achieve her happiness through running by giving the endless support and help that influence Katie to keep going regardless of her health condition. Next, we will talk about the development of these three people. According to Erikson's lifespan development theory, development proceeds in stages, and each stage is characterized by a psychosocial challenge or crisis, and stages reflects the motivation of the individual. As for Joseph and Katie, they were at stage 5, which is identity versus role confusion. Identity means essentially how a person sees themselves in relation to their world. It's a sense of self or individuality in the context of life and what lies ahead, while role confusion is an absence of identity, which is the person cannot see clearly or at all who they are and how they can relate positively with their environment. Based on the documentary videos, both Joseph and Katie already got their identity. For example, Joseph really enjoyed his social life with his friends and his university life, even though he had to go through some challenges in his life due to his epilepsy. He chose to believe that he can socialize with other people and mix well with his surrounding and live his life like a normal people. Then, for Katie, she found her identity to become a runner. Even though her health is quite not suitable for becoming a runner, she believes in herself, does not give up, and keep chasing her dream because by doing that, she could feel happy, calm, satisfied, healthy, and positive with her life and make it as one of her self-treatment or medication. Moving to the last person, Chris. Chris was at the fourth stage, which is industry versus inferiority. Industry refers to purposefully and meaningful activity. It's the development of competence and skill and a confidence to use a method and is crucial aspect of school year experience. Erikson described this stage as a sort of entrance to life. Based on the documentary video, we can see that Chris is such an active and confident kid and good in both academic and sports. For example, during class, he decided to give a PowerPoint presentation about his epilepsy. He was really confident in doing that. It showed the other kids that he is not afraid of epilepsy or seizure, so they also should not be fearful, and the kids really found that presentation quite interesting and make them a bit more calm and sort of welcoming to Chris and a bit more supportive of his epilepsy. As for sports, Chris is really active and loves football and karate. Chris has this belief that epilepsy isn't a disability. Thus, I think what his mother and his teacher were doing, which is allowing him to do what he loves, is the best thing ever, because this is the chance for him to sharpen his potential and talent that is good for his life development. As a conclusion, seizure or epilepsy is a chronic non-communicable disease of the brain that affects people of all ages. Being diagnosed with epilepsy can be devastating because of the altered road you know is ahead. Not only does this condition affect people physically through seizure, but it also can affect people emotionally, leading to feeling of grief, sadness, or even anger. Thus, for people who suffer with epilepsy, they should learn about the causes of their condition as well as the treatment that can help to reduce or treat their disease from time to time. And then, as the normal people, we should always give support to them to help them to overcome or lighten all the challenges that they face from epilepsy, because our support is the most crucial thing that they need the most to go through their day, and with that, they will be a person who is stronger and believe that they can enjoy their life and succeed in whatever they do like all normal people in this world. That's all from us. Thank you.